As opposed to benign hepatic tumors, malignant hepatic tumors are cancerous, very severe, and are actually now the third leading cause of cancer deaths worldwide. With these malignant liver cells, or hepatocytes, just like malignant cells in other cancers, they develop some mutation that causes them to replicate at way higher rates, and form these masses of cells that continue to grow and potentially spread to other tissues. Now this would be a primary hepatic tumor, since it starts in the liver. Now if the cancer is able to metastasize and gets into the bloodstream, it most commonly goes to the lungs as a secondary organ. It's totally possible, though, for a liver tumor to develop as a metastasis from another primary cancer, in which it would not be a hepatocellular carcinoma, but a carcinoma from somewhere else. And this is actually way more common than primary liver tumors themselves. The most common sources of the tumor cells that got to the liver but started somewhere else are the colon, the pancreas, the lung, and the breast. Alright, but what exactly causes the mutation in the hepatocyte, though? Well, the mechanism isn't fully understood and can probably be caused by a lot of different things. Most importantly, though, things that put the liver in a constant cycle of damage and repair are the biggest culprits. If the liver cells are constantly being forced to repair, this raises the chances of genetic mistakes or mutations, which potentially leads to carcinogenesis or development of cancer cells. Examples might be any disease that leads to cirrhosis and scarring of the liver tissue, which can include alcoholic hepatitis, hereditary hemochromatosis, primary biliary cirrhosis, alpha-1 antitrypsin deficiency, and others. The most common risk factor, the one that's been linked the most with hepatocellular carcinoma, are the hepatitis B and hepatitis C viruses, both of which can become chronic and long-lasting. In this case, the cells are at greater risk because of the constant state of infection and immune cell attack, which leads to this constant damage and repair. HBV is particularly problematic because of how the virus replicates. The HBV virus is a DNA virus that integrates into the hepatocyte's DNA, which, although not completely understood, is thought to either directly disrupt regulation of cell growth and replication, which leads to carcinoma, or cause some indirect effect that later leads to unchecked cell growth and replication. One interesting risk factor, though, is exposure to aflatoxins. Aflatoxins are highly toxic chemicals produced by certain aspergillus molds that can be found in certain foods when they start to decay, like grains, peanuts, and vegetables. As foods that have this type of mold are eaten, aflatoxins are also eaten, and then they're absorbed in the small intestine and sent to the liver for metabolizing. The most potent type of aflatoxin thought to be involved in carcinogenesis is aflatoxin B1, and when it gets to the liver, it's metabolized to aflatoxin B1,8,9 epoxide. And now this guy can bind right to DNA, called a DNA adduct. And this interaction leads to mutations in the p53 tumor suppressor gene, which usually, when it's functioning right, stops the formation of tumors. So if it becomes mutated and dysfunctional, tumor formation and carcinogenesis might follow. Now, because most patients with hepatocellular carcinoma also have cirrhosis, the hepatocellular carcinoma can be hard to spot. Symptoms of long-standing liver disease like cirrhosis often masks the progression of carcinoma, and often patients have no symptoms directly related to the tumor itself. A delay in detection of any disease typically means a worse prognosis, right? And hepatocellular carcinoma is no exception. In general, the cancer might be focal or limited to one area, but it might also have several areas affected and be multifocal, or it could even spread diffusely through the liver tissue and not really have any distinct focal points at all. A classic sign of a secondary hepatic tumor, though, are multiple focal points that can even be sometimes felt on the free edge of the liver. Now, a common place for the tumor to spread is in the portal and hepatic veins, where a mass of tumor cells might lodge and block the veins. If the hepatic vein is blocked, pressure builds in the portal system, which pushes fluid into the peritoneal cavity and leads to abdominal swelling, called ascites, and perhaps hepatomegaly, enlargement of the liver. This blockage of the hepatic vein is also known as Budd-Chiari syndrome. Because their abdomen's swollen from ascites and hepatomegaly, patients might present with abdominal pain as well as fever due to the destruction of liver cells. Having said that, a relatively large proportion of patients, though, about 1/3, are asymptomatic, and as such the cancer is found incidentally. On histology, it's common to see bile inside the hepatocytes, as well as the smaller cancerous hepatocytes invading the spaces around the larger normal hepatocytes. Also, in the blood, a big-time indicator is an increase in alpha-fetoprotein, or AFP. AFP is normally found in abundance in fetal plasma, but drops off to smaller amounts into adulthood. AFP is also, though, produced by the tumor cells, or cells that are proliferating. So as those tumor cells proliferate, more AFP than normal can be found in the blood. Blood ALP and GGT will be increased as well, both of which are enzymes typically found in the liver that can be released after liver cell damage. Finally, some additional proteins can also be elevated, like erythropoietin, which controls the proliferation of red blood cells, insulin-like growth factor, which promotes cell proliferation, and parathyroid hormone-related protein, which can be secreted in higher than usual amounts by tumor cells. Imaging procedures can be helpful in making a diagnosis, like CT scans, ultrasound, and particularly angiography, which can help show vascularity of the tumors. If the tumor is found and can be surgically removed, which is about 20% of cases, then the survival rate is improved by quite a bit. But if it's not able to be removed, then survival is much lower, and in the range of months to years. Typically, radiation and chemotherapy have not been shown to be super effective, but certain patients might be candidates for a liver transplant.